Hi, my name's Emma and I'm going to describe the homeopathic birthing kit today, but within a particular reference to births that are instrumental or surgical. So a lot of these remedies are going to be useful for any birth or in any birthing kit that you might take along to your labour or birth. But I'm going to give the particular use when we are going to have a instrumental or caesarean birth. So whether it's a ventouse or vacuum as it's also called, or any forceps births, or a low uterine caesarean section. So the first remedy I'm going to describe today is arnica. So arnica is a very good first aid remedy for any bruising or trauma associated with both a normal or an instrumental or surgical birth. So every woman should have this in her birth kit. But it's also a good family kit as well, remedy as well. So you can start this remedy perhaps in the late of the third trimester as a preparation for birth and prevention for any pain, trauma and a few other things such as perhaps a postpartum hemorrhage as well. Can also be started as soon as labour starts or in between labour if you haven't had the opportunity to start taking the remedy in advance. And also if you know you're going to have a caesarean section, you can start taking that in advance as well to prepare you for that. Often used every few hours during labour. But it might be once a week or a few times a week as you're leading up to labour. And of course, as it's a first aid remedy for any injury, if the woman has some sort of injury or fall, particularly if she's a bit bruised and battered, that can help the bruising and the trauma and the shock as well. In a normal or an instrumental birth, the arnica may help with recovery of bruising of the perineal area in particular. So obviously after a birth, the baby stretches and potentially even bruises and tears the area. So this remedy helps heal that and any pain and trauma and shock associated with that as well. And of course, after any caesarean section, the surgical wound pain and bruising might be potentially helped by arnica as a first aid remedy as well. And it also may help with after pains while you're nursing the baby as well. If there is any postpartum hemorrhage that's caused by a known trauma, it might be helpful. And as I mentioned before, it might be helpful in the first place for preventing it, hopefully. Obviously, hemorrhage is an emergency situation, so we do need to take advice of the healthcare professionals that specialise in this, such as the midwives and obstetric doctors as well. The next remedy is Ballus perennis. So this is a useful remedy for any deep surgical wounds. So this can be used if arnica is not helping, or you could potentially even alternate with the arnica if they're both helping you a little bit. Also useful for deep perineal tears, injury and bruising after birth. And then also might help the after pains as well. So Ballus perennis is a useful addition to any kit as well. Staphysagria is the next remedy. Staphysagria is particularly useful for any post-surgical pain, when the mother feels violated, angry and let down. So this can be because she's had a caesarean or instrumental birth, or perhaps she's been violated after any internal vaginal examination. She might have also had a urinary catheter inserted as well. So this could be in general during labour, or if she's having a hemorrhage, they want to make sure the bladder's clear if she can't pass the urine. And also any woman that has an epidural anaesthesia is going to automatically have a urinary catheter because you can't feel that you need to go to the toilet. So the catheter does the work for you. If there's been any minor surgery, such as an episiotomy that has occurred, so the little cut that they do in the perineum to help baby come through if there's any particular reason that you need to expedite birth. So particularly when the woman feels particularly violated and angry as a result, you can use Staphysagria. And the next remedy that you can consider to have in your kit is phosphorus. So if there's a general anaesthetic that has been used, phosphorus could be used as a first aid here to help clear any general anaesthetic. It doesn't happen much these days in a birth, because most women, if they do have any anaesthetic, will have a spinal or epidural, but there is a possibility. But phosphorus is also a good first aid remedy for some postpartum hemorrhages, so particularly where there's a copious red blood loss associated with anxiety and fear that something bad will happen. Usually in this case the placenta is complete, and when this happens, usually it's also helpful for the overstimulation and exhaustion that occurs as well. And the next remedy we're going to discuss is Hypericum. So Hypericum is a good remedy for a spinal or epidural anaesthetic that has been used that has caused pain in the lower back region, so the sacrum and the coccyx area, and also might be helpful if you've had forceps to help assist the birth. So the Hypericum is particularly good for all the little nerve endings and nerve pains. Aconitum is the next remedy we're going to talk about. So Aconitum is a useful fear remedy. So the mother has extreme fear, causing fear for her life. She may have had an emergency caesarean section or a gushing postpartum hemorrhage with lots of fear and restlessness. And she often also has a bounding pulse. Aconitum is also useful for the baby who has fear in its eyes due to a birth trauma. The next remedy is Calendula. So Calendula can be used as a diluted mother tincture, and it's helpful for healing any wounds, cuts and scratches after birth. So whether it's a normal birth or a surgical birth, you can dilute the calendula with water, or sometimes things like aloe vera and so forth can be helpful to dilute it as well. But it can be patted on the perineum with a soft cloth or flannel or something to pat on the area, or even like in a sitz bath, and can also be obviously patted on the surgical wound as well. So yeah, that's a few remedies that can be very helpful in your birthing kit, which can also be a normal birth or a caesarean or instrumental birth. So if you need to get any of these remedies, it's usually associated with a short consultation or even a long consultation, depending on the situation. You can contact me or your own homeopathic practitioner. Yeah, so it's also good to have a doula who practices homeopathy in your birth as well, or an independent midwife who is trained thoroughly in homeopathy as well. It can be quite helpful. So thank you for listening, and good luck for your birth, your pregnancy, your labour and your postpartum experience, and I shall see you again soon.